Video, I would like to talk about a scenario of testicular cancer. Usually, testicular cancers are seen in younger age group, 15 to 35 years. That's where the peak incidence is. And I remember them with a mnemonic called PEET. So, painless swelling, embarrassment, because people are not happy to go and see a doctor for a testicular problem or a lump inside. So extra testicular symptoms, then time of onset. Okay, so presentation is usually 99% of the time it's painless testicular swelling or lump. I've seen 4 to 5 patients. They are all young people around 28, 29, 30-ish. Then they present with heaviness, and very rarely they see like pain, but there's a history of cryptorchidism and family history of testicular cancer, very very important in the history. Sometimes when there is a mix up of hormones, you will have gynecomastia. That's very rare. I've not seen anyone. Very rarely you see systemic metastasis. So key findings are, again, you can use a mnemonic called firmness, irregularity, regional lymph nodes, metastatic signs. So that's what I usually use. Local features and associated signs. Local features are usually firm, hard, irregular testicular mass, smooth, painless enlargement. Anything that's painless in the testis or breast, serious thing. Always you have to be careful. In the exam you have to do the trans illumination, and it's negative. If it's hydrocele, that is positive. So that's very very important. Then to rule out the differentials, usually you do ultrasound of scrotum, because there you can see if it's a solid or a cystic lesion or hydrocele or hernia. Usually that's what will be seen there when you do the ultrasound. Then serum tumor markers, you can test them as a general practitioner or a doctor. As a junior doctor, you can check for these because these will be raised. Then to confirm the diagnosis, of course, you have to do a CT scan. Then to rule out metastasis, you need to rule out all this CT as well. Then treatment is, again, by radical inguinal orchidectomy. It's a diagnostic and therapeutic. That's a confirmatory thing. Let's go to the differentials. Like I already said, epididymal cyst, spermatocele, hydrocele, orchitis, testicular lymphoma. These are very rare things, but hydrocele is a common one, especially when someone has a trauma. Epididymal cyst is very common as well, and orchitis is common. Epididymitis is another similar presentation, but it will be painful, and patient will usually have history of STDs. So management plan, you have to go to surgical. If it's diagnosed early, it'll be inguinal orchiectomy or RPLND procedure, and testicular prosthesis. That's it's more for cosmetic appearance. Non-pharmacological or radiotherapy and close surveillance. Pharmacological, hormonal, again, I never seen anyone having this. I've seen some young middle-aged men having chemotherapy. And mnemonics, again, ABCD for assessment. Blood markers, clinical examination. Examination is the key, and investigations are the key. And explaining and management of the patient is important as well, because it's a young male. Usually they're scared of cancer, so you have to be very empathetic. This can have like a spikes protocol as well, which is a breaking bad news scenario. So this can be a separate testicular lump case, or a young person was recently diagnosed with testicular cancer, break the news. So multiple scenarios can be framed on this. So make sure you remember all these things, and I hope this is helpful. If you need more, like this, share this page, and subscribe to the channel so I can do more videos.